So hip dysplasia and impingement actually are more prevalent than one would think. It's about 10 to 15% of the population suffering from either dysplasia or impingement. It's the most common cause of hip pain in adults under 40. And as you saw in the story of Amanda, dysplasia can be a leading cause for osteoarthritis if left untreated. And these are patients in their 20s and 30s. So if possible, a total hip replacement should be avoided at all costs. So we made it our mission to develop a novel treatment for hip dysplasia in young adults. So we wanted to develop a minimally invasive procedure that had a more predictable outcome, faster recovery, and also reduce some of the complication risks, like resorption of the graft that we've seen sometimes with these shelf acetabuloplasties, and also avoid creating impingement problems. So what we did was we reused the concept of this shelf acetabuloplasty because it does have a good outcome and a good success rate. But instead of using a bone graft, we decided to use a patient-specific implant, which is designed based on CT and then manufactured using metal 3D printing in titanium. And so, as I said, we start from this concept, and then we have developed this implant that you see here on this bone model. So this is a titanium implant with the lower part is actually the active functional part of the implant, if you will, that sits on top of the joint capsule. It does not go inside the joint. It sits on top of the joint capsule, but it provides additional coverage of the femoral head, additional stabilization of the joint, and it distributes the loads better, reducing symptoms and slowing down the development of osteoarthritis. Now, when we were developing this product, we noticed that we needed to develop a new software tool, better software tool, because we were developing a patient-specific device. So we needed to be able to measure with high precision very specific anatomical parameters of these patients' hip joint based on CT images. We also needed to identify where the acetabular defect is, so where the acetabulum in fact is too small, where we needed to provide, or where the implant needed to provide that additional coverage. And also we need to make sure that the implant nicely fits on the patient's anatomy and that it resolves the femoral under coverage. And we wanted to be able to verify the implant geometry once placed inside the patient against a range of motion, to make sure that there's no limitation of the range of motion of the hip joint due to the presence of this implant. So we developed our own software. This software allows us to make a very detailed anatomical model. This is not new, obviously. This has been around for quite a while, to make a 3D model of CT images. But what our software does is to really make very specific measurements. For example, the blue area that you see here is the part of the femoral head coverage, or the part of the femoral head that is in fact covered by the acetabulum. And then the middle graph here, you see again that blue line that maps in a polar graph what that coverage looks like. And then we can use this as well to decide where this acetabulum needs, or where that coverage needs to be extended. So that then serves as input for the implant design. And then also with the software, we can do motion simulation and see if there's early contact anticipated between the implant and bone. And then we can iterate and adapt the implant design as needed. So then we showed these measurements to surgeons. They were very positive, very enthusiastic about the measurements that came out of this, which led us to the decision to develop this into a separate product or a service in this case. So using that software, we now offer a service, which we call a hip studio analysis service. So we use that software to generate a report, very detailed report, to support diagnosis and treatment planning of hip preservation, both impingement and dysplasia. It measures a wide range of anatomical measurements that are also relevant for the 3D shelf implant. It allows a kinematic simulation, impingement detection. We also include healthy reference data for easy interpretation. The software itself has AI and machine learning built in, for example, for image segmentation and the detection of impingement.